Hello, this is Dr. David LaRocco's leg and cold laser in the flesh. So I wanted to take a minute because people ask me questions all the time about the cold laser, especially when I mention it for wound healing. So on Christmas Eve, I was injured while doing a box jump in Canada, and I cut my leg open to the bone and damaged some muscle tissue and fascia, which is kind of like the saran wrap that covers your muscle. So this is my fourth day of lasering this wound, and anybody that's queasy, well, you may want to look away. So um, I am a chiropractor in Holly Springs, North Carolina, and I wanted to share this video basically because I wanted to share this information on the benefits and effects of cold laser. So it's kind of hard to tell, but I had my shin bone here, where I'm hitting the red light, was badly damaged. Again, I saw it and it was raised up. And I just wanted to demonstrate with what I'm doing with the laser, which is putting it on this wound for about 10 minutes. Now, the cold laser, which I'm going to pan back, and I'm going to come over to my workstation. Okay, here's the cold laser that I have, and that's the base unit. So what I'm doing is actually stimulating the body to reproduce mitochondria, to reproduce new cells, to help the wound heal faster. 3 days ago, I wasn't really able to walk that well. It was pretty painful, my leg would throb. I immediately started using the laser, like I said, 3 days ago. This is being the fourth day, and believe it or not, it looks significantly better, as ugly as it looks. And, we can reference that through some pictures that I took of when it first happened to when I took a picture a couple of days ago and what have you. So as you can see, I'm getting right in there, and I'm really trying to get that wound, the laser in that wound and what have you. What's the violet for? I see a purple light and I see a red light. Well, this is also called a dermatological laser, so it works really well for skin conditions, so on and so forth. So you pick a skin condition, right? If you're having issues with some eczema or psoriasis, this can work really well to helping alleviate the symptoms of that, the external effects of it. So you can see I'm really getting on that wound, but I'm also getting here too, because this is where the bone was badly bruised. It's a very powerful laser. Now it is cold, so I don't feel anything, maybe a little bit of warmth, but this is non-invasive, it doesn't hurt, and then you just feel the effects after a couple hours, typically, what most of my patients say. Myself, I felt it immediately after 10 minutes. And we're going on 4 minutes now with this. And I felt the swelling and edema go down, and that's kind of what you want. And so I'm going to pull back my sock, see if I can see yes, I still have a little bit of hitting edema there. I have what I call my cankle. All right, so even though this is where the problem is I want to make sure the laser is hitting the whole area, right? It's just, think of it as like a frequency to tell the body to heal faster in this area, expedites it. So there's a lot of research and a lot of data on this. What I typically recommend for people, depending on the scenarios, 24 to 48 hours per treatment, and it also will vary on the condition that you're treating of how many visits. Approximately, this should take me about 12 to 14 sessions, where some may require 6 to 8, and some may require 20 to 24. It just depends on the nature of the problem that you're dealing with. So this is a wound. So I'm kind of in the middle with this. Now, after 12 visits or 14, does it mean that I'm not going to do this anymore? Probably not, because I want the scar to heal as quickly and nicely as possible. As you see, I got a nice V in my leg, appropriate since my wife's name is Veronique. Okay. So anyhow, there's the cold laser. There it is in action. Appreciate you guys watching. Comment if you feel like you want to leave any feedback or questions. Happy to answer to the best of my ability. And remember, only you can make today great. And this is Dr. David LaRocco of Elite Spine and Wellness, signing off.